Today I'm here at Salem Plastic Surgery and we're going to be talking with Dr. Howell about 7 interesting facts about himself. So what was your first car, Dr. Howell?
My first car was this amazingly fast, no what? It was this little white Toyota Tercel hatchback, 4 cylinders, probably had about 2 horsepower to it, 4-speed manual, and I was so thankful to have the car, but it felt like Fred Flintstone, where if I packed it up with 5 of us for soccer practice, we felt like we had to bust our feet through the floorboards to try to get enough power to go up the little hill to get to soccer practice. But he got me through, and I learned to drive a stick. So
Got you from A to B.
That's exactly right. That's what I needed.
Now, as a parent, what was your proudest or most exciting moment?
So that's kind of a tough one because I feel like the whole journey with kids has been a bunch of proud moments. You know, all this stuff with hitting their milestones and walking and crawling and talking back to you and all that kind of stuff. But yeah, so it's a whole series of probably proud moments, and the most exciting would definitely be just the birth for each of them. We didn't find out if we were having a boy or a girl, and so it's up until the litter.
Surprise.
Yeah, the last second, it's a boy or a girl. So, yeah, lots of excitement.
Now, other than cycling, do you have a favorite hobby or activity you like to do?
Kind of like we are right now. I really just love being outside. So hiking and camping with my family has definitely been one that's high on the list. Even when the kids were little, we took them for like an overnight up at Mount Rogers, and they survived. And we brought 2 kids there. We brought 2 kids back, so we felt like that was a success. And other things like trail running. I love exercising and trail running, being outside and kind of getting through the woods and whatnot is another good form of just kind of getting out there. And kind of like cycling, therapy, doing the trail running and hiking and all that. Other forms of just kind of good exercise and mental therapy and stuff in good ways.
Now, what do you enjoy more, cooking or being cooked for?
Yes, I would say both. So I love being cooked for and having good meals at restaurants or having somebody cook a good meal. But I love to cook as well. So like even when my wife and I were first dating, that'd be kind of one of our little dates would be to find something in cooking light that's kind of easy but fun and exciting to make, and do a little cooking date. And then even now, sometimes just kind of randomly coming up with stuff. Nothing special, but just experimenting in the kitchen and having the good eating that comes with that, and even like doing a good slow cooking on a ceramic grill is a good way to spend the day.
There's a lot of talk around the office about your salads. I've heard they're quite interesting, to say the least.
Yeah, I guess interesting is kind of a matter of perspective, right? But they do kind of have a point. So I do tend to like leftovers. I'm not afraid to eat leftovers. Sometimes it may even be stuff where it's kind of pushing the edge on expiration dates or whatever. But more than just an interesting combo. So yeah, it might be throwing some beets on there because there's some in there, and some olives, and then some artichokes, and then lettuce, and then throwing some hummus. But to me, it all sounds great. But it does
sounding less and less like a salad.
Yeah, it's easy to get some responses about like that. Well deserved.
Now, I know you talked about camping and traveling places. What are some of the most interesting places you've traveled?
So when I was in medical school, my dad's actually a retired general surgeon, and we had the chance to go down to kind of southern area of Africa to India and do a mission trip there, and another one to Cameroon a year or so later. And those were both like really interesting places just because it is complete third world and access to care. People have to travel sometimes hundreds of miles to get to the small little hospital that you had, and they reuse stuff all the time, and you just kind of make do. So it was a very interesting place, and kind of the whole medical side of things. And then when I finished up my cosmetic fellowship in New York, and right before starting practice here, my wife and I went to Australia for 2 weeks. And so we got a chance to see kind of the Daintree Wilderness area, which is like a rainforest area, and some of the desert areas. Melbourne, like the Opera House. So just completely different area that we got to go see, and it was it's really just a neat place to go, and a lot of culture. And I might have run into a kangaroo there, but that's another story for another day.
Now, I know you can spend a lot of hours in the operating room. What's your favorite type of music to listen to while operating?
So that's a good one. Yeah, it totally depends on the day, and it depends on the mood. It's usually something on kind of like the folksy pop side of things. So maybe something like in the vein of like a Mumford and Sons. Other times it might be a little more bluegrassy. Other times a little more, rock and even like classic rock, Zeppelin and some of those. So it totally depends on the day. I do remember a time early on in practice when I was very much in the mood for a bunch of like heavy metal Metallica kind of stuff, and I pretty much burned out my nurses in a very short period of time with that. So we ended up then, having to change it. But yeah, so it just depends on the day. And I always give everybody in the OR full veto rights. So if they are not liking the music or sick of a song, they can change it or move it or bump on past. So yeah, everybody gets a little bit of input on that.
All right. Well, thank you for talking to us today. It was great getting to know you.
Yeah, it was fun. Enjoy it. Thank you.
Thank you.